Hello? Do you guys know about HIV? Oh, you guys doesn't know what it is? Then let me and my team show you what is HIV.
Let's talk about how does HIV started in Malaysia. In the early 1986, the first HIV case in Malaysia started when a 45 years old Chinese male with American origin fell sick while visiting Malaysia. In the early 90s, the HIV case trends seems increase in the intravenous drug users. In order to address this growing epidemic, the Malaysia Ad Council were established, and in the 1993, the Malaysia Ad Foundation was founded in order to support the fundraising for AIDS program. In the present, the World Health Organization has classified Malaysia as a concentrated epidemic, as there is growing cases of HIV in our country involving the injected drug users. Based on the latest data, the statistic of HIV as of 2023 has shown that there is 85,000 of people living with HIV. The HIV incidence among the adult aged 15 to 49 is about 0.14 among 1,000 people. This number highlights the ongoing impact of HIV in our community and underline the importance of continued awareness.
Next, let's proceed to the symptom of HIV. So, what are the symptoms of HIV? So, there are several symptoms of HIV, and not everyone will have the same symptoms because it depends on the person and what stage they are in. So, there are 3 stages of HIV, and let me explain about 2. So, for the first stage, called acute HIV infection, within 2 to 4 weeks after infection, about 2 or 3 people will have a flu-like illnesses because this is the natural response to body's infection by HIV infection. So the flu-like symptoms can include fever, chills, rash, night sweats, muscle aches, sore throat, fatigue, swollen lymph nodes, and also mouth ulcers. So these symptoms can last anywhere from a few days to several weeks, but some of people does not have any of these symptoms during this early stage of HIV. Next, stage 2, called clinical latency. So in this stage, the virus still multiplies, but at very low levels. People in this stage will not have any of the symptoms and does not have any sick. This stage is also called chronic HIV infection. So without HIV treatment, people can stay in this stage for 10 to 15 years, but some also move through this stage faster. But if you take HIV medicine as prescribed and get and keep an undetectable viral load, you will not transmit HIV infection to your HIV negative partners through sex. But if your viral load is detectable, you can transmit HIV to your HIV negative partners through sex. So it is important to see your healthcare provider regularly to get your viral load. Always get checked.
If HIV is left untreated, it will weaken our immune system and lead to the third and final stage of HIV, which is acquired immunodeficiency syndrome, in short, AIDS. So there are several symptoms for AIDS. For example, extreme fatigue, diarrhea lasts more than a week, recurring fever or night sweats, rapid gain in weight, and so on. Thus, we have covered the 3 symptoms of HIV. Now we will be moving on to the causes. So HIV is a virus that can be spread through contact with certain bodily fluids. So let's look at how HIV is transmitted and what doesn't cause it. So HIV is transmitted through contact with certain bodily fluids, for example blood, breast milk, semen, and vaginal fluids. The most common ways HIV is transmitted is through unprotected sex, which doesn't involve usage of condom or HIV medicine that can help to treat or prevent it. Other than that, sharing of injection drug equipment like needles also can transmit HIV. HIV also cannot be transmitted through casual contact, for instance hugging, kissing, or sharing meals together. with our friends or family. HIV also can be passed down from the mother to the child during pregnancy, childbirth, and during breastfeeding. So, understanding how HIV is transmitted is important to help us think of a way or come up with a prevention ways.
Fun fact, there is no cure for HIV. So how do we treat HIV? We can use antiretroviral therapy ART, which involve taking a combination of HIV medicines on a regular schedule by taking pills every day and injections once a month or 2 months. So how does this medicine works? So HIV medicine prevent HIV from multiplying, which reduce the amount of HIV in the body called the viral load. Having less HIV in the body gives the immune system a chance to recover and produce more infection fighting CD4 cells. This medicine also reduces the risk of HIV transmission to other peoples.
Now I'm going to talk about some important precautions and preventive measures that can be taken to reduce and protect ourselves from HIV. HIV is a manageable disease, but as per any other disease, precaution is always the best approach. First and foremost, you can protect ourselves from HIV by the practice of safe sex. What is safe sex? Safe sex is the act of sexual intercourse with the help of contraptions such as condoms. These contraptions help protect our body from the exchange of bodily fluids such as semen and vaginal fluids, which can often carry and transmit HIV. Next, we can also reduce or avoid high-risk behavior such as premarital sex. Premarital sex can significantly increase the chances of us contacting HIV. Let's talk about blood safety. As we know, HIV can be transmitted through contaminated blood. So, we need to make sure that every medical and dental equipment we use are properly sterilized. This equipment includes things such as syringes and needles. Never ever share or reuse your syringe or needles, as this can significantly increase the chances of contacting HIV and other infections. Additionally, blood safety is also very important when it comes to things such as blood transfusion. Always make sure that the blood you receive is from a tested and screened donor to reduce your risk. Next, regular HIV testing is key, as regular testing can ensure early detection and treatment so that it can improve quality of life as well as reduce the spread of the virus. If you are at risk of HIV, taking medication such as pre-exposure prophylaxis or PrEP can significantly reduce the chances of contracting HIV, as this medication helps reduce the chances of it. This medication can be taken as an injectable treatment or pills, which can significantly reduce the chances of HIV. And finally, if you are living with HIV, it is very important to take antiretroviral therapy or ART. This therapy can reduce the load of the virus to undetectable levels, which means you can't spread the disease to others through sex. This is also known as undetectable, untransmittable, or UU.
HIV or human immunodeficiency virus is a virus that attack the body immune system, especially targeting the CD4 cell, which are crucial for fighting infection. If left untreated, this virus can weaken the body over time, hence making it harder for the body to defend itself against virus and infection. HIV can be transmitted to contact with certain body fluid. While this virus has no cure, however, it can be managed with antiretroviral therapy, which can allowing the patient to live longer and healthier with reduced risk of transmitting the disease to others. All these options, however, early diagnosis and treatment are the key in to controlling the virus and preventing the progression to AIDS, the most severe case of HIV.